In Haiti, we have a maternal mortality rate right now of 350 per 100,000. What that means is that for every 100,000 women who deliver, 350 of them will die. There are 2 or 3 interventions that collectively prevent maternal and newborn deaths, and that's skilled delivery.
So the matrones or midwife program is essential here in the communities. The tradition and the community position of a midwife is something that's passed down from generation to generation and given as a legacy, transmitted through the community. And now the hospital is interfacing with this important cadre of health workers by instituting the matrone program and educating them on how to identify high-risk pregnancies, which conditions have to be referred to the hospital, and which conditions are actually safe to stay at home with.
There are 2,500 babies that were born at HAS in 2015. Approximately half of those were born at the hospital because they were high-risk complications, and approximately half were born in the communities with the assistance of our matrones.
The rate of the deliveries, the rate of the C-sections, every day, every month is increased. The population also in this area is increased.
15% of all women are going to have complications that need emergency services.
At HAS, our service of maternity is special. We have the maternity with high risk. In this area, the other hospital, they don't have the possibility to do C-section. So the rate of C-section at HAS is very high. For example, during the weekend, when the other centers, the other hospital, they close, HAS is open 24 hours. So this kind of women, their life was really critical.
On a vu un cas tout à l'heure, c'était un cas d'éclampsie. Quand elle était enceinte, elle n'est pas venue en consultation, donc on n'a pas pu prendre en charge sa tension artérielle.
There's still the risk of seizure even after delivery. We start with the medication before the C-section, but we have to continue to with the medication and a lot of monitor. Even after the C-section, we have to continue with that.
So the Johnson & Johnson grant helps to cover the costs of our maternity care, both at the community level and at the hospital. So it helps to cover salaries for our obstetric nurses. It helps us purchase needed supplies that we have to use every day in our obstetrics ward here at the hospital, as well as our 4 community health centers in the communities. It also provides for training in emergency obstetric.
HAS is one of a handful of facilities in the entire country that can provide what we in the maternal health community say all of the signal functions of comprehensive emergency obstetric and newborn care. And we do it 24 hours a day, 7 days a week, with all of the precautions in place.
HAS is committed to providing high quality care at a low cost, but we also understand that there are patients that can't afford even the low cost of our care. So with partners like Johnson & Johnson, we're able to provide subsidized care for these patients and so that they have access to the care that they need.
It's really the most critical component of a continuum of care for mothers and newborns, because you can do as much prevention as you want to do. Of course, that's extremely important. Great screening during pregnancy. HAS does that. We screen hundreds and hundreds of women every month in the community for high blood pressure and for other danger signs during pregnancy. But even with the best of care, 15% are still going to need a hospital like HAS that can step in when there's an emergency and save her life and save the baby's life.
Par chance, on a pu sauver les bébés et sa vie, mais ça pourrait être fatal parce qu'elle a eu des crises. Ensuite, les bébés ne sont pas à terme et on ne savait même pas qu'il s'agissait de 2 bébés parce qu'il n'y a pas eu d'ultrason pendant la grossesse. Bon, elle allait avoir plusieurs crises pour l'éclampsie. Elle allait perdre la vie et les 2 bébés également, donc on allait perdre 3 personnes.
HAS is extremely grateful for the assistance that Johnson & Johnson has provided us over the last 10 years. With their financial help, we've been able to provide quality maternity services to women throughout our catchment area.